And at 4:30, we are joined once again by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. And we always appreciate your time and your insight, Doctor. More than 40 states are reporting increases in COVID cases right now. 4 of the 5 highest number of single-day cases during this pandemic were reported just over the last week. So what is your analysis of that? Do you believe that we're entering a period that's likely to be much worse than what we've already seen?
There's no question, Maria, we're going in the wrong direction. We're starting at a high baseline, much higher than we were in our first wave. Now it's not just regional, but it's the entire country that's involved. This is a real problem. I'll also tell you something else. I just walked out of a patient's room with COVID-19, and her viral load in the back of her nose was about 100 million copies. And that's the rule for the patients coming in right now. So not only do more patients have COVID-19, but each patient has more of it. So our community, our state has more virus than we've seen before.
So that is an abnormal load, because we don't know what those numbers mean. Is that an abnormal load? Is that what you're talking about?
A very high. As the pandemic goes on and as things improve in the summer, patients had much less virus when they came in.
Got it. Let's talk about some other states, because officials in Ohio and Wisconsin, for example, say that their states are being ravaged by the virus right now, or describe it as being out of control. So what can people do here in Massachusetts right now to avoid that kind of a situation, and how are our hospitals prepared right here in the Commonwealth?
Well, I mean, Ed, to avoid a state lockdown or national lockdowns, we have to intensify containment measures. We know what they are. A lot of it has to do with our behavior, but we have to limit crowds. We have to limit a lot of the transmissions are happening in informal gatherings. A lot of younger people are not wearing masks. It's the things we keep talking about. But if our behaviors don't change, we're going to see exponential increases in viral transmission.
Let's talk about vaccines. Dr. Anthony Fauci saying that Cambridge-based Moderna, Pfizer, neck and neck in this race to a vaccine. Both may have one at the same time. So any good estimate on how soon that could be? And if 2 companies were ready simultaneously, do you believe that that changes the outlook for the virus?
Maria, remember, we need to vaccinate hundreds of millions of people in the United States, not just once, but with Moderna and Pfizer's vaccines twice. You need 2 injections. Yep. Think about those numbers. So we don't just need one company, we need many. So the next thing we have to do is find safety and effectiveness data. And then remember something, availability isn't the same as accessibility. You know that these vaccines to travel need to be frozen or super freezed. So, the accessibility is going to be tricky.
So let's talk about the calendar, Dr. Ellerin. It's Halloween this weekend. What is your best advice and ideas for parents on keeping their family safe and healthy?
So, Ed, you may not know this, but Halloween is my favorite holiday. So what I would say is let's be careful again. The safest thing is to probably keep things in your own bubble. If you are going to be giving out candy to the community, you want to try to have individually wrapped goodie bags. Make sure you wash your hands, things like that. Also, remember, the Halloween masks are not the same as the masks that reduce transmission for COVID-19. Some of the common sense things are important. Keep those numbers down.
So double mask is what you're saying, right? Mask under mask is the way to go.
If they can breathe. I want to be careful, because some of these costumes, you have to make sure you can breathe.
Good point. Dr. Ellerin, great to see you as always. Be well.
Take care,
Thanks,
guys.
Doctor.